Okay, so welcome everyone. This is the latest interview in our Israel's LGBT Organizations Explained series. This week we have the pleasure of talking to Saar Maoz from the Israel AIDS Task Force. There he is. Let me just change the view as well. There we go. So I'd like to welcome you. Thanks very much for joining us. It's really great to see you here and have you here. And thanks to everyone who's joining us in the Zoom session as well. As always, this is going to be available as a recording afterwards on our Facebook page and on our YouTube channel as well. Let's hear from Saar. Hi Saar, how are you doing?
Hi, how are you doing? Thank you very much for inviting me. I'm very happy to be here. And I think we can have a great opportunity to talk a little bit about what I do and what our organization do. And also hear from you what you want from me. What you want from me? Yeah, let's see. I'm here for you, and I'm interested in the questions you guys already asked and in preparation for this evening, but also anything else you guys would like to know.
Stuff. So we should probably start by saying what your job title is. So you're the Deputy CEO of the task force and also the LGBT community coordinator. Is that correct?
That's right. That's
Lovely.
right.
So what do those roles involve?
So I've joined the Israel AIDS Task Force in 2013 after living in the UK for 18 years. And I'm there ever since. So it's kind of, I think it's soon going to be something like 7 years. And in my current role, I am responsible for education and raising awareness and creating test centers that are testing center for HIV and STIs that are specifically located or opened for the LGBT community. And in the last 3 years, I've been in my role as a deputy chair, which means that it just means a lot of boring stuff, dealing with money, dealing with human resources and the staff experience and million other things that are not really falling on any particular of department of our department, and it comes to me, which is definitely a great honor and a great opportunity for me, and I love doing that.
So how did you get involved in the AIDS Task Force in the first place?
Well, to be fair, I've been diagnosed with HIV in 2003 and lived in the UK and had no aspiration specifically to work in the area of HIV or to be involved. I felt like that I was healthy and I was taken care of, and that there is plenty of other people that are doing stuff. So why do I have to do it? And like, just let me get on with my life. And it's been like that for many years. Many years I didn't find a lot of like I relate to it from my own circumstance, but not from an activist kind of place. And then cut the long story short, basically in 2011, a friend of mine asked me to join a little TV series that he was making, and we filmed, and he was filming for Israel, and called, the name of it was Families, and me and my family joined it, and with that we started like a journey of talking about the way it made me and my family feel that I contracted HIV and that I stopped being religious and many other facets that came up, and that TV series was quite a big deal here in Israel, and it got me talking and thinking a lot about HIV, and also with almost without me completely understanding, uh, it turned out that one of the first people who kind of went on TV and said that he was HIV positive and let people into their life in a kind of more, although it wasn't a reality and it was definitely a documentary, but in a more realistic kind of day-to-day life experience. And that had me kind of made a name for myself about it without being around. Um, and then I just started talking to the Israeli AIDS Task Force, and one of my visits here, they asked me to come around and chat to people living with HIV, and we started knowing each other, and I realized that there is a lot of work to be done here in Israel in terms of stigma fighting and like activism on, you know, like on governmental level and others, and it just really lit a fire in me, and I kind of felt like suddenly like I was that it was the right time for me, and I had the energy and I had the wanting to come back around my family, and basically all this like excuse my dog. um, um, and it all came together, and it was great, and they offered me a job, and I actually made Aliyah. Well, I didn't make Aliyah, but I returned home after many years where I didn't really think that I am gonna ever come back here. So so that's pretty much the story.
You mentioned stigma there. Do you think there's still a stigma around HIV
I think
positive
it
people
changed.
here?
I think it changed a lot. I I don't want to kind of do that, but because I don't think it's me, and I don't think it's only our organization. I think a lot of things changes in these 7 years. We managed to highlight something that was completely covered, like I'll tell you all about it because I'm not sure everybody know, but in 2012, in a conference in Switzerland, there was the first time that this word undetectable was mentioned. And at that point, and that mean undetectable mean that is not transmittable, that people who live with HIV and take medication cannot infect or pass on HIV to anybody else. And that happened in 2012, which is a long, long, long time ago. When I arrived in Israel, and I was really fully in the work at 2015, still nobody knew about it, although it was a thing, a massive stigma fighting tool, as well as a great news, but nobody heard about it. So that was the first thing. And the second thing that happened in these 7 years is that, first of all, there was research and proof that PrEP works. And that meant that suddenly the gap between somebody who lives with HIV and takes certain medications, somebody who doesn't live with HIV but takes the same medication almost, is the gap shrunk. And those two game changers sort of happened in those years, and also were not that familiar in Israel. And our job in these years, it was to make this information available for start, and then create like campaigns, ad campaigns in bus stops and wherever, on condom packets and wherever we could, to make it known and available, first of all in the gay community, but then also to everybody else. I don't think we finished like, I think there is still stigma. I think if somebody, for example, live with HIV in Tzfat or in Be'er Sheva, is still not an easy thing to deal with, and certainly not an easy thing to disclose. But I think that that the situation is much, much, much better. And I see it certainly with the amount of like people come to us with telling us about discrimination at work or in many facets, but basically that occur a lot less. We hear people that come to get tested with us, and the way they talk about people that live with HIV, we see the stress level. So we have certain different measures and different point in our meet with the community that we can kind of measure it, although it's not quantifiable really, stigma. But I think it's improved a lot, and I think there is still a long way, and I still think we have few tricks down our sleeves, and that we are going to carry on and do that.
Wonderful. That's great to hear. So you mentioned PrEP there. So PrEP is available in Israel. If someone wanted to, so for example, I mean, again, this series is aimed at people that have either made Aliyah recently or are thinking about making Aliyah. So if you were to move here, how easy, difficult is it to get yourself on PrEP?
So I think since we are also at the Israel AIDS Task Force taking care of returning citizens, and also we taking care of people, of immigrants or people without any permits, I always say that the good news is that Aliyah is the easiest of all of them. You know, like this is the best position to be in, because the first time you do Aliyah, the first time you come to Israel, in many ways, and I absolutely don't believe that it's easy. It's definitely not easy, but I think it's easier. It's much easier to come on that ticket or in that sense, and that means that that you are basically can get all the services and benefits and rights of any other Jewish Israeli person pretty fast, in a pretty fast way. And, and I believe from what I know, and it's more you more than me, but I in relatively not in a painful way, like without much pain of bureaucracy along the way. So as far as I know, with Olim who are HIV positive, which I've met over the years, and also with the one who's not, basically you can just, the minute that you are assigned to a Kupat Cholim or HM, or you know, in American they say HMO, then with a healthcare provider, the moment you have that set up with the health insurance, Bituach Leumi, then you can ask your doctor about PrEP, and in a minute I'll tell you which doctors to go to and how to do it. But generally, what I want you to live with, what I want to leave you with, is the fact that it's good, it's okay. There is PrEP in Israel, and you can get it. And it's just a matter of how to go about it. And how to go about it is basically a list of trained GPs, family doctors that can sign PrEP. These doctors have gone through our training. You know, we devised like special training, and we did that in partnership with the Foundation of AIDS Doctors, and basically they go through a module. At the beginning, it was like day or two of lectures, and now they even have like a web like a web module that they can go through and learn and get tested on, and they should know how to treat people kindly when they come to ask for PrEP, and how to make themselves accessible to and without being judgmental about different sexual practices and the kind of patients that are going to arrive to the clinics if they're going to open themselves up to provide PrEP. And basically, you know, like in every other country, you have to go through blood tests and STI tests, and then check kidneys and hearts and all of that stuff to make sure that you are able to take PrEP, and then you can just go on. And PrEP costs in Israel something in different HMOs. It costs differently, but around 200 shekels a month, which is not bad. We still have a fight against it. We still think it's too high. But
so 200 shekels is about $50 US.
Okay.
Is that about right? Yeah.
And we still think that that we can get it lower. This is part of our stuff for the future. But at least it's accessible and almost for all, you know. So that's PrEP. And since I'm talking about GPs and since I'm talking about Aliyah, I think it's also important to take a moment and say and talk about what happened if you're already living with HIV and you're making Aliyah. And like I said, I think basically the system here is ready and waiting for you, and it's fine. And I know there is contradiction of information on the web about what will happen and what will not happen and what's allowed and what's not allowed. And let me let me ease your mind about it and just say that it's really fine. So my recommendation to anybody who immigrate to Israel, and it doesn't matter whether they're making Aliyah or returning to Israel, it's always come with a supply, because it's a bureaucratic country and take time. And although Aliyah is the fastest way to go through the bureaucracy, it's still, you never know, it changes from one person to another, and the places you choose to live and do ulpan, if you choose to do it, is different. So I would say come with a little bit of stuff so you're not stressed.
So we're talking about maybe, sorry, we're talking like maybe 2 months worth of meds?
Again?
We're talking like 2 or 3 months worth of meds, would you recommend? Or?
Yeah, 3 months in the country that allow it. I think in the US, many places will give you only 1 month, then take that. But whatever you can take, so to give you a bit of a breathing space. And then I was going to be cheeky and say, if you have any leftovers of medication later on, you can always donate it to us, because we give it to like illegal immigrants or asylum seekers that are here and are stuck without any governmental response, and their life depend on it. So, you know, here's my plug: donate medication to us. But yeah, and then again, you know, you live with HIV, you come with the medication, you sign up to Bituach Leumi, to the national insurance, and after short period, I think you might, and maybe you want to help me, you might be able to even do it from abroad, so you don't even have to wait till you come to Israel to start the process. I don't know. Check it with your Aliyah, how do you call it? Aliyah.
Yeah, the Aliyah advisor. I think generally what happens, and again, you know, I've been here 8 years, so when I arrived, they take you to a little office, they give you, these days, they give you your ID card as well, they take your photo, which is the last thing you want after a 8-hour-long flight, and generally overnight, you feel like you look awful. And one of the questions they ask you is which of the health providers do you want to join? And so once you've got that, you know, there's a little bit of paperwork to be done, but you can literally go and find yourself a doctor, I guess, talk to them about your medication, what you've been on, and get yourself a prescription. So, like I said, it
And
can take
that's,
months. But
and that's amazing. So, you know, in Israel, and that's maybe the time to mention that in Israel now, one of the amazing things that happened in the last few years is that we have LGBT specialist family doctors. There's one in Amerikaz Ageh in Gan Meir, and that's Klalit. That's for the Kupat Cholim Klalit. And then there is another one near Habima, which is Kupat Cholim Maccabi. And I know of Klalit and Maccabi are setting up now LGBT specialist family doctor clinics in Haifa. So these things is now something that's starting to take place all across of Israel, which I think is stunning. Really, it's like it's weird to say that about just something that should be so obvious, but it's really moving to see it taking kind of place, and more and more people wanting to join those places, doctors wanting to join those places. So let's say you go to your family doctor and in an LGBT clinic or not, and from there you can just let them know that you're living with HIV, and they'll direct you to your specialist doctor, which could be in one of 7 hospitals across the country, which have HIV/AIDS clinics or departments, and over there and this is how it goes in Israel. Over there, you will go to the hospital, to the HIV clinic. They'll do all your HIV-related blood tests and other tests if they need. They will be able to then recommend which medication you should take, or maybe continuing the medication you had abroad, if it's available in Israel. And I will say already that all the medication, the latest medications get to Israel really, really fast, normally a year or 2 after they're out. So anything that is available in the US will be available in Israel. And normally we are ahead of Europe. So whatever you come with in Europe, you might find that we have a better medication in Israel, and you can change your meds if needs to. And so you will do that with your specialist doctor in the hospital, and he will decide and together you decide what kind of medication you have. And he will then give a letter to the family doctor, which will make a prescription, which you will take to the pharmacy. And by Passover, you will get your medication, maybe, or you will sing Chad Gadya or something. It's very bureaucratic. But again, I think these 2 clinics I mentioned in Tel Aviv, the family doctors in Tel Aviv, are already working with emails and with those prescriptions sent by email to the pharmacy. So it sounds like very muddled and difficult. But actually, once you get in the system, you've done it once, you'll find out that it's a lot easier. Although I wish we find a way to cut the middleman in Israel with all of these things. It's just sometimes really annoying, and just it's the way it is here. So better get used to it. That's all about HIV. In any case, I wanted to also mention that if you are HIV positive and you are going to travel in the world, just so you know, we talked about it in our previous chat in preparing to this. I really recommend this this little website called hivtravel.org, which you can just find information about any country in the world and the rules they have about getting into this country with HIV or medication. Just if you want to have fun, just try Dubai or Iran or or any of them, and you can find all sorts of fun and funny stuff not over there. But I think for HIV, people living with HIV, it's a concern, and it's just a really easy way to get this concern off your head, and like find the reality. It's
That's a great idea. Thank you. I've just put a link for that into the chat.
Normally, it's a lot better than you expect. Say again.
I've just put a link to that website in the chat window. So hivtravel.org. Okay, that's a really useful link. Thank you for that. One other question I wanted, we've talked about people that want to get on PrEP. We've talked about if you move here and you're already positive and getting the medication you need. What about PEP? What about post-exposure?
Well, PEP has been in Israel for a while. Actually, before I met them, before I came to the country. So I think from 2010, it's been in the system, and it's now really well. It works really well, the system. So basically, let's say you had sex with somebody, and you had them, I don't know, you didn't use condom, or the condom broke, or any other situation where you feel like you need to take PEP. I'll just say quickly, PEP is a medication which you can take within 72 hours after exposure to HIV. And if you take it for a month, then we know that it's almost 100%
success rate, yeah.
Well, yeah, it works almost in 100%, and that you will not get HIV. It doesn't take care of any other STIs, but it can really help if you know that you put yourself at risk. Also important to know that although we say it's up to 72% after this instance that happened, but the closer it is to the instance, the better. So really after 48 hours, it's already kind of start being a bit dodgy. All you have to do is to call your family doctor, get a Toffes Form 17. It's very important. It's the one that basically tell the hospital that the Kupat Cholim is going to pay for you to come to a
services, yeah.
How do you call it?
It's like a third-party health provider, isn't it?
For the emergency room, it's gonna pay for. So Form 17 is gonna pay for your emergency room to take care of you. And basically, you arrive to emergency room, and you're not gonna be high on the list because they probably have somebody with a broken arm and a cut-off leg and whatever. So
And I know they've got 72 hours to deal with you, I guess.
Yeah, exactly. And you have to be prepared to wait.
Yeah.
I know that even in places that are doing this really well, sometimes people wait for 4 or 5 hours before they're being seen. But you will get to a doctor. He will give you, once he checks that the instance that you were really at risk, then he will decide whether to give you or not, but to give you a medication for normally 24, if it's the weekend, 48 hours. So one dose for 1 day, or 2 doses for 2 days. And after that, you will have to get to the same hospital to the HIV clinic, and they will provide you with the rest of the medication, or give you a prescription for the rest of the medication, provide they are satisfied that you were really at risk. And over there are specialists, so they can have a more open conversation and understand the situation better. Like I said, it works. If it happened, do it.
Yeah,
if it
absolutely.
happened.
Sorry, you made me smile because I think you're the first Israeli I've ever spoken to that's used the word dodgy. You're showing that you spend some time in the UK.
There you go. It was worth sending me to England.
Excellent. One thing I wanted to ask you as well was about HIV testing. So I know that at least 3 of the 4 HIV, sorry, at least 3 of the 4 LGBT centers. So Tel Aviv, Haifa, and Jerusalem, they have like one day or one night each week
That's right.
where you can go get
That's
HIV
right.
and
So
other
right
STI
now,
testing.
that's right. So basically, part of the Israeli Task Force have a department which I'm responsible for, called Bella Doeget. I will not go into the history of that, but what we do is we understood many years ago that that a lot more people feel better to come and get tested in our own LGBT community center rather than to come to places where there is all sorts of people that arrive to. We do a testing evening on Sunday at the Gay Center in Tel Aviv and at the LGBT Center in Haifa. Jerusalem also have one evening.
I think also Sundays.
Yeah. Sundays.
Yeah.
Yeah, I wasn't sure. It's not run by the Israel AIDS Task Force, but I will say that we are a great partnership with them. Basically, their people came and trained with us, and we go over there and do stuff together. So I think it's a great place to go and get tested, and obviously much friendlier way. We had a lot more opportunity to test before this COVID-19 busted. Basically, we used to go out and do testing in mobile testing outside of clubs and having like events where like always be with a mobile testing vehicle, like in gay events and stuff, which
Nice.
mostly happen in the summer. This summer has been cancelled. It's official, so we didn't do that, and we have our ear to the ground regarding to when we could go back to these activities. But we have every intention to come to do them because they mainly. What we find is that a lot of people do their first ever test in those mobile testing places, and they find more guts, and maybe they are with friends or whatever, and it really is useful. So so and always get updated on the Israel AIDS Task Force website or on Bella Doeget website, like Facebook page, and we will just let you know what we do.
Excellent. So I wanted to. I'm just looking for the Bella Doeget Facebook page.
It's not English friendly.
No, okay, fair enough.
Okay.
I can't multitask in Hebrew just yet. Well, I'll look for that later. So I wanted to open it up to the people that have joined the Zoom session. Are there any questions from anyone here that you'd like to ask Saar about? Don't be shy. If you want to, you can type them into the chat window, or you should be able to unmute yourself as well. So whichever way you want to do it, please feel free to ask. No? Okay, it seems that we've covered all our bases. Is there anything else you wanted to mention, Saar? Is there anything we've missed out?
Well, just I feel a bit like, well, I can't say I'm an immigrant because or that I made Aliyah myself because obviously I was born here and like that. But I think anybody who decide to take his life or live his life and whatever he's familiar with and move and live in another place for whatever reason is a bit of a hero. And I think really, I mean, I think I'm saying it with no cynicism at all. I think it's a massive thing to do. And if it's happening because of ideology or wanting to make a better life for yourself, or thinking about a greater picture is a big deal. And I think, first of all, I just want to say that, and I want you to know that I know that, and that I know that it's not easy sometimes, but it's still, I hope it's still worth it, and that our organization door is always open. And I know, like everything else in Israel, it can be difficult and in Hebrew, and not always like immediately getting the response you need, but try us, and be determined about getting what you deserve, like anybody else who live in Israel. If you speak English, you're in a good place, because you know, if not English, then even worse.
And also just
Yeah, the VAD is really open, for people living with HIV, but also for people who just want to ask questions about your sexual health and about your sexual habits, and whatever it is you need, we will try and encompass. These days we are more and more looking into like chemsex, and people who in you know, there is this new term, or it's not that new, but that we are more and more looking into of gray prostitution, or gray, or the way people kind of use no, it's not the right. I don't have the terms in English yet. I noticed that, but basically anybody who's dealing with them with either paying money or taking money or any other thing for sex, and we have an open door for that, and we want to hear about that as well, and take care of that. So but and many other things. So just come and talk to us.
Sure.
Our door is open.
Okay, so we had a question here in the chat window, just privately, asking about how the healthcare works. So there's basically 4 Kupat Cholim, there's 4 healthcare providers, correct? I'm going to forget some of them. There's Clalit, which is, I think, the largest. There's Maccabi, there's Meuchedet, and I can't remember the last one.
Leumit.
Sorry?
Leumit. So Clalit, Maccabi, Meuchedet, and Leumit. And Meuchedet and Leumit are very small, and they are almost at the point that they are joining with one another to one big kupa. I don't know if it's a really thing that is happening, but they do many things together, especially because they traditionally there were kupot cholim that were situated in very specific places. So, for example, קופת חולים מאוחדת or לאומית, I don't remember which one, is really most of its clients are in Jerusalem. So it's the strongest קופת חולים in Jerusalem, and so it caters for very specific kind of population, but in other places you can't even find like a clinic, or there are very small amount of clinics. So generally I recommend people join Clalit. They are the biggest one. It's the one that have the most money. It's also made it, I find it more generous in some way, because they are able to, because they're responsible, I think, for 1.5 or 2 million people health in Israel, which is a big stake in the pie. So I think for that reason they are not, if they have to make an exemption of something in the rules or whatever, it's not such a big deal for them. And that's why I think they are maybe slightly better than the others, but this is only my personal opinion. I'm sure there is other people that will say otherwise.
And so, I mean, for example, so one of the guys here is planning to make Aliyah and to settle in Netanya. How difficult, how would you go about finding an LGBT-friendly doctor in that part of the country?
It would be really easy. I'm not sure there is one in Netanya, but I think it would be. It's very easy to find one. And there is like a association of gay doctors, of LGBT doctors, and it's worth kind of looking at their list and see if there is anybody in Netanya. There might not be, but Netanya is not that far away from Tel Aviv. It's a short travel on train or on a bus. What is it? I would say half an hour.
Yeah.
So, if you're not somebody who need to see your doctor more than once or twice a year, then maybe it's worth joining the one in Tel Aviv and doing that, So it depends. It depends your specific needs and I think most doctors are okay, It's important to say most doctors are liberal and they're okay. And if you find that after the first or second meeting with your doctor they're not okay, change your doctor. Don't wait to think about it and see if it gets better. Just change your doctor. You have the rights to do it. Just do it. And if you do find that you want to ask things that are LGBT related and you find that your doctor cannot answer you those questions, then by all means find an LGBTI doctor.
Yep, absolutely. Thanks for the question. Did we answer your question? Okay there. Please let me know if you've got any other questions. And again, really one of the reasons I wanted to invite you to talk to us, because again, over the years, I've been, running LGBT Olim since 2013, and I get emails from people in various situations, making Aliyah, thinking about making Aliyah, and, some of those have been from people living with HIV, concerned, questions like, do I tell my Aliyah advisor that I'm positive? And my answer is always, it's completely up to you. Some people that are negative to choose not to come out as gay or LGBT, sure. Their Aliyah advisor. It's totally up to you how comfortable you are with it. Again, but I want people to know that firstly, you're not going to be denied Aliyah just because of your HIV status. There's nothing in the law of return that says, oh no, we don't want the gays. That just doesn't exist. So you've got just as much right to be here as anyone else who can prove that they are Jewish. And like I said, bring a couple of months worth of meds. That'll tide you over while you get things sorted and get the prescriptions and as necessary. And then things should be fairly, plain sailing.
Yes,
yeah, actually it can be.
Exactly.
Wonderful. Are there any other questions before we let this good man leave? Good stuff. All right, wonderful. Okay, so I'd just like to say thank you very, very much, Saar.
It's great to have you. Thanks a lot. I think it's the second time I'm doing stuff with you, and
That's true. It's been a couple of years.
I'm here for you, and let's meet again.
Wonderful. All right, thank you very much. And everyone else, thank you for joining us, and have a great evening. Thanks a lot.